Alcohol withdrawal patients can be very tricky to care for. And so, for this week's tip of the week, we're going to be talking about all the tips and tricks for caring for ETOH withdrawal patients. We get ETOH patients a lot in the ICU, and that's because they really need very close monitoring during their active withdrawal symptoms. Typical withdrawal symptoms start usually about 24 hours after their last drink, sometimes sooner, sometimes later, and then usually peak around the 48-hour to 72-hour mark. In severe cases, this time frame may be extended, but the most dangerous part of alcohol withdrawal is definitely those first couple days after cessation of drinking. It can be very dangerous to withdraw from alcohol, especially if you're trying to do it on your own. Never recommend doing it on your own. Talk to your provider. There's outpatient treatments available and inpatient treatments if you are experiencing more severe withdrawal symptoms. One of the biggest concerns in alcohol withdrawal patients is seizures. These patients are very high risk for experiencing seizures and require a lot of benzos to keep up with preventing seizures. Most hospitals follow a CWA protocol for patients that are withdrawing from alcohol, and this protocol scores patients in all of these categories, and depending on how high they score, you can medicate them appropriately with whatever is ordered for your PRNs based on your CWA. For mild patients, they may just require like PO Ativan, and for your severe patients, you may be giving PRN Ativan up to every 15 minutes. Giving your patients benzos during alcohol withdrawal is going to, one, help prevent seizures, and two, is going to help with these symptoms that they're experiencing. There are cases where your patient is in such bad alcohol withdrawal, you're giving them a bunch of benzos, it's not working. I've seen providers order phenobarb for these patients, sometimes a Precedex strip, and in very severe scenarios, we will actually intubate someone and sedate them for a day or two or however long they need to help them get through this active withdrawal. From a nursing perspective, besides adequately scoring your patients on CWA and medicating them appropriately, you're going to want to make sure you keep these patients safe. A lot of times they're very confused, they're very agitated, they're trying to climb out of bed. A lot of times they need to be restrained or have a sitter. And so always keep in the back of your mind your safety as well. Patients that are actively withdrawing can be very, very aggressive. And so you need to make sure that you're being very smart and very safe. Some other concerns for these patients are typically they're not eating or drinking. They probably haven't been eating or drinking very well because they've primarily been consuming alcohol. And then when they go through withdrawals, they're usually super out of it and agitated that they're not able to actually sit and eat a meal. So nutrition is going to be a big thing. Another big concern for these patients is going to be their mobility. Someone's going through very severe withdrawal symptoms. We're just trying to keep them appropriately and safely medicated, that a lot of times they're not moving around as much or they're at risk for skin breakdown. So as these patients get better, of course, we're going to want to keep them mobile, and we're going to want to keep doing that passive range of motion and whatever we can do to help facilitate these patients from getting weaker. I've seen severe withdrawal take weeks for patients to start coming back around. A lot of times, besides just being delirious from the actual withdrawal, they actually get hospital delirium on top of their alcohol withdrawal delirium. And so it just exacerbates the delirium and makes it take a lot longer for these patients to recover. And then, of course, once they're through the active withdrawal, it's going to be preventing this from happening again and offering them resources and counseling, maybe getting psych involved, so that way we can help these patients from going back home and starting the process over again.